It is almost Marketplace open enrollment time for 2025. So let's talk about it. How to get your enrollment done, how to get it done on time, how to pick the right plans, and how to avoid all of the big mistakes that can happen when you are enrolling in Marketplace coverage. My name is Jo Hutchison. I am a broker with Founders Life and Health here in beautiful St. Louis, Missouri. And today we are going to tackle everything related to open enrollment for 2025. Make sure you stay all the way to the end of the video. I have 4 common mistakes that people make when they are enrolling in their Marketplace coverage that we're going to want to avoid, and I'll talk about that towards the end. Okay, 2 things first. 1, Obamacare, Marketplace, ACA, Affordable Care Act, all of these things are the same thing. And I know some of you have had comments to me in the past about using the word Obamacare, that it's not actually the name of it. Yes, I know that it is not the actual name of Marketplace or Affordable Care Act coverage, but a lot of people use the word Obamacare. So just to make sure that we are getting all the information, all the people that need to get it, Obamacare, Marketplace, ACA, Affordable Care Act, it's all the same thing. Also, if you're seeing this and it's not during open enrollment time, that's totally okay. Everything in this video is going to apply to you as well if you have a special enrollment period that's coming up. Special enrollment could mean you've moved into a different county and you need a new plan. It could mean you've lost a job and you need Marketplace coverage. It could mean that you retired early and you need Marketplace coverage. There are lots of different circumstances that would cause a special enrollment to pop up. So all of this will apply to you as well, even if it's well after open enrollment period. So first of all, what is open enrollment for Marketplace? I'm not going to spend too much time on this. If you found this video, you probably already know what it's all about. This is the time period that we can use to enroll in a new Marketplace plan for the following year. All Marketplace plans cover pre-existing conditions, and there's no medical underwriting to enroll in a Marketplace plan. So it's not that you are just allowed to enroll in a Marketplace plan this time of year without medical underwriting. You will never have medical underwriting for a Marketplace plan. This is the time of year when you don't need a special enrollment period to enroll. Let's talk about timeframes. When is open enrollment? So open enrollment is going to start on November 1st, and it will go through December 15th for a January 1st start date. In most states, open enrollment actually goes through January 15th for a February 1st start date. So if you are watching this January 7th, 10th, whatever, you still have time. Your plan won't start until February 1st, but there is still time to enroll. Who can enroll in Marketplace coverage? So there's 2 groups of people that can enroll right now in Marketplace coverage. If you already have a Marketplace plan and you're not happy with your plan because the network has changed, you may have just gotten your notice of change from the carrier to let you know costs have gone way up, a prescription isn't going to be covered anymore, a doctor that you're seeing right now is no longer going to be considered in network. Now is the time to look at a new plan, find that doctor in network, find the prescriptions that can be covered in the plan. Now is the time to change from the Marketplace plan that you have to a new Marketplace plan. The next group of people that Marketplace enrollment is wide open for are people that don't currently have coverage. So if you haven't had coverage for a while, maybe you've never had coverage, maybe your employer dropped you, maybe you left a job that had coverage and just never got coverage again. Now is the time to go ahead and enroll in a plan that can start January 1st. Another group of people that this open enrollment period is going to be especially important for are the groups of people that have been carrying short-term medical coverage. This year, new rules got put in place as far as how long short-term medical coverage can stay in place. Some of the programs that were out there were up to 3 years, and those programs are going away. So if you had short-term medical coverage that was a 3-year plan, you likely have gotten a letter saying that your short-term medical coverage is going away. It's not going to be a thing anymore. Many of the plans were 6-month plans. Those plans are now limited to 4 months. So in addition to that, the cost for short-term medical that is in place for 4 months went through the roof. So if you have a short-term medical plan and you want to get off of that and into a Marketplace plan, now is the time for you to do that as well. I do real quickly want to touch on the why of Marketplace as well. Marketplace coverage is actually really good coverage if you know what you're doing, if you get yourself enrolled in the right plan. Marketplace coverage will cover pre-existing conditions. If you have something that you can't get covered through, if you're trying to get a private PPO plan or something like that, Marketplace coverage will cover it. all of your preventative care on a marketplace plan is going to be covered. That's going to be your colonoscopies. It's going to be your annual OBGYN exams. It's going to be your mammograms. It's going to be just your annual physicals. Those appointments are going to be covered 100%. So maternity is covered. Mental health coverage is covered. That can be a little bit trickier, and we can talk about that in a different video, but it's good coverage. You just have to know what you're looking for and how to find the right plan. When you are in healthcare.gov, you have to know what you're looking for, and sometimes that can be overwhelming because once you put all your information in, you're going to get hit with all of the plan information. One option is within healthcare.gov in the marketplace, you want to look for a button that says Help on Demand. You can click on the Help on Demand button, and that is going to give your information to a local broker in your area that will then get in touch with you. Hopefully they'll get in touch with you pretty quickly. They will either call you or email you, and then they can help you enroll in a plan. The other way to go about it is to get in touch with a broker. So you can get in touch with us here at Founders Life and Health. You can get in touch with a broker in your area. But a broker that is familiar with Marketplace is going to be able to take your information, figure out what the best fit is going to be, provide you with several different options, and explain the plans and tell you how the plans are different and find one that's going to be tailored to your needs. You can always reach out to us here at Founders Life and Health. You can call the 800 number or reach out to us through our website and set up an appointment to talk. Our services are always free of charge to you, and we are licensed in most states throughout the United States. Let's talk about what not to do when you are enrolling in your marketplace coverage. These are 4 real important things that you should know going in so that you don't have any issues down the road. The very first one is going to be making sure that you're reporting your income correctly. And that can be tricky, especially if you have just lost a job or if you've retired and you're not completely sure of what your income is going to be going forward. So what they are going to be looking for is your adjusted gross income, which is line 11 on your 1040. What you're going to do is you're going to be basically giving them an idea of what you expect your adjusted gross income to be for 2024. When you go to do your taxes in 2025, if that number is different, if it's greatly different, you're going to have tax implications either way. But what you don't want to do is underreport your income. I always suggest to my clients that we overreport just a little bit if we can. If you underreport when it comes tax time down the road, you're going to have to pay some of that subsidy back. So we want to make sure that we're getting it as close as we possibly can. Like I said, sometimes that's tough. So if we need to, let's try to overreport just a little bit. What not to do. Item number 2 is going to be, please don't expect that you are going to get all of your doctors in the same network if you have a lot of doctors. Sometimes I talk to people that have pages and pages of doctors, and there's absolutely no way with a marketplace plan that we're going to be able to get all of those doctors into the same network. One of the biggest struggles with marketplace right now, and every year it gets a little bit better and a little bit better, one of the biggest struggles with marketplace right now is networks. So if you have 5 or 6 different doctors and 3 of them are in one network and 2 of them are in the other, chances are good we're not going to be able to get all of them in the same network. But keep in mind that if it's a doctor that you only see once a year, for example, if you go to see your OBGYN and you only see them once a year for your annual checkup and that doctor is not in network, it might be worth it, maybe, to contact the doctor, find out what just an out-of-pocket pay would be for that. So you may end up saving a lot more money on a different plan where that doctor wasn't in network, and you can just, for that one visit a year, go ahead and pay the $120 or $150 or $100 or whatever their out-of-pocket cost is for not using insurance for an office visit. So if we get to that point, we can work through that together, figure out what the doctor's charge is, and if it's worth it for you to just pay out of pocket for that. Third thing that you are going to want to pay attention to when you're enrolling in a marketplace plan for open enrollment is to not jump on the very first plan that you see that has the lowest premium without looking at all of the details. So what I hear a lot of times from people that have had marketplace and have not had a good experience with marketplace is that, well, they never paid for anything. The reason that that happened is because the plan that you enrolled in is having you pay the entire deductible before any real coverage kicks in. So as you're going through the plans, maybe the very first plan that pops up is going to have the lowest premium. If you look right next to it, it will say, you have to pay whatever the entire deductible is, $9,000 a year or whatever. So it'll say doctor's office copays, 50% after deductible. That means you have to pay that entire $9,000 before you can actually get a doctor's office copay. I don't like those plans, honestly. I'm looking at plans that will have real coverage before you pay the entire deductible. You should be able to see a doctor. You should be able to see a specialist. You should be able to have lab work done or an x-ray or any of those things before you pay the deductible. So if you know what you're looking for as you're going through the plans, you can find those plans and make sure those are the plans you're enrolling in, not the plans that are going to have you pay the entire deductible up front. Okay, last one, and this one is a biggie. Please, please, please do not go around the internet and put your contact information into all of these junk websites that are just going to blow you up with spam. They are not health insurance companies, they are lead generation companies. So what they do is they suck your information. You put in that you need a health insurance plan, you give them your name, your phone number, your email address. And next thing you know, you're getting 40 phone calls a day from people all over the country that are just sitting in call centers trying to get you to enroll in a marketplace plan, and it's terrible. Don't do that. Make sure that if you are giving your contact information to anybody, it is a legit health insurance broker that is not a lead generation company. People get so upset about that, and I wish that there could be like a big warning that says this is not a health insurance company, this is actually a lead generation company. Nobody wants to get 40 phone calls a day from people trying to sell them health insurance. Blah. Hopefully that was helpful, and please feel free to reach out if you have more questions about your own health coverage or if you need help enrolling in a new plan for 2025. And thank you so much for watching.